Hi, everybody, and welcome to 13 Now. I'm News 13's Amy Hoyt, and we're coming to you live this afternoon from our newsroom in downtown Panama City. Today is our Buddy Check Day, where we remind you to check for lumps in your breast, and of course, if you find something, to call your doctor right away. 1 in 8 women will develop breast cancer during their lifetime, and of course, early detection is key. The next step after that would be a mammogram. It's the best tool, of course, to screen and diagnose breast cancer. But what happens? It's a conversation we've been having for weeks now. What happens if you don't have insurance? You know, those of us who do have insurance take it for granted. You just go get your annual mammogram if you're over 40, and it's a thing. They take your insurance, the insurance pays for it, and you're on your way. But there are people out there who work, have jobs, might be low income, but they don't have insurance, and they can't get that mammogram. And this started weeks ago with a Facebook page where a young woman who had posted anonymously in a local Facebook page and said, I think she said she was 42, a single mom. She worked, but did not have insurance, and she thought she found a lump. So we started to research it. And so we called the health department, we called Ascension Sacred Heart Bay and Gulf Coast Hospital, and we have found some resources where you can go if you're low income or you need a free mammogram. We're going to start today with our special guest who has driven down from the Jackson County Health Department, Katrice Davis, and you are Human Resources. What is your title? I apologize.
Human Resources Program Director. It's a fancy title.
You do everything, don't you?
Yeah, for chronic disease prevention. So,
okay, there you go. And now you offer a breast cancer diagnosis type program for breast cancer and cervical cancer. But let's talk about breast cancer today. How long has the program been around?
So the program's been around for a long while. I know I started around 2015, so even longer than that, so over 10 years. It's been a program that's been available through the state of Florida, and they provide great services.
Okay, now who can use this program?
So the women, any woman that is a Florida resident, they must be low income or fit the income qualification, which is the 200% underserved, or be an underserved or uninsured woman. And for us, underserved means that you may have insurance, but your insurance doesn't cover those services.
Okay. And is this is for women who are 50 plus?
Oh, yeah. So the age that they target is 50 to 64. If a lady or a woman is younger, and usually the 40 to 49, if they have an issue, find lumps, we do suggest that they talk with their doctor, and then they may be able to recommend or refer if they feel that that's something that is needed at that age.
Okay. And this program, you're from the Jackson County Health Department, but this program covers all 9 counties in our viewing area.
Yes, so the program covers 9 counties. Wow. That includes Bay County, Calhoun County, Franklin County, Gulf, Holmes, Jackson, Liberty, Walton, and Washington.
Wow.
So a large area, and it is covered throughout the state of Florida, so there is no excuse. There is a program for everyone.
Okay. Tell me a little bit about how it works. Let's take this anonymous poster on Facebook, for example. She's found a lump, she has no insurance, and she calls you. How do you direct someone like that?
So to be eligible, like I said, you only have to be a Florida resident, age 50 to 64, qualify for the income range, and then be uninsured or underinsured. So when they call, if they fit those qualifications, all they would have to do is complete a package, what we call a packet. And in that packet is a referral form. That referral form would ask all the questions that the staff would need to review to make sure that the woman qualifies for the program. Once they qualify, a staff member will basically follow them through the whole process with helping them make appointments, whether mammograms or any other services that they need. So it's a really easy process in just getting in touch. The providers do have access, local providers have access to the packets, what we call the packets and the referral sheets. So they may be able to refer if they find that someone needs that. But you can also, like you said, refer yourself by calling the Jackson County Health Department, who is the, agency, area that covers all of the counties. And we will be able to get you connected with a provider and get you started with the program if you qualify.
Okay, so you're basically having to fill out an application.
Correct. And it's a simple application. So we like to say that because it really is, but just to get information to make sure that you feel fit the qualifications.
Is this something that can be done online, or does it need to be done in person?
So right now we do it in person because just to have that one-on-one, like I say, the staff members provide like ongoing assistance and helping out with finding a provider, setting up the mammograms and things like that. So in person, we do work with the providers so that in the counties, because it is such a large area, that the providers can be that person that maybe guide you through that or assist with guiding you through that. So we usually do it in person, but the packet is available online and it's on our websites.
Okay, let's say, for example, someone in Bay County. They call your office, but can they go to the local health department in Bay County to fill that out?
That is correct. You go to your local health department or your provider. We work with the primary care providers as well to make sure that information and those packets are available. And like you say, the other option is to call us directly, and we can provide that service with helping the woman complete the application or connect her with someone maybe that's more local that can do that.
So you basically are the starting point.
Oh, yes, the starting point and here through the end.
And Jackson County is kind of centrally located, so that makes it not that far to go, really, within an hour's drive for everybody.
Yes, it's worked. We work with, like I said, all the health departments. There's staff that can, communicate and work with anyone in all of the counties. And we've been doing a really good job, I must say. I worked with the program before, and it's really a great program because everyone we work with is so excited about providing that service if it's needed.
Now, women won't actually get the mammogram at the health department, correct? You're going to forward them to a doctor.
Yes, that is correct.
Okay.
So we have different sites and people in Florida or places in Florida that we can refer you to. So it'll be your local places that you would normally get your mammograms. We would just connect with them or figure out a way to be sure to let them know that you're a part of the program and that those services are available to you.
Okay. What am I not asking you about the program? Have you ever had any questions that you think, let me put that information out there?
Okay, so, and I know you kind of touched on it, but the one thing I thought about is people that have insurance or feel like they have income sometimes feel that they may not qualify for the program. That is not correct. Having a job or having income and having insurance does not automatically disqualify a woman from being a part of the program. Of course, you have to fall in that income range, and we can help you figure that out with that packet that we were speaking about. And if you are insured, what we call underinsured means that your insurance, you have insurance, but the insurance provider does not provide mammograms or even pap smears. This program covers mammograms and pap smears. And so you may be eligible in that case where you have insurance, but you don't have access to those services.
What should they bring with them to prove that they're a Florida resident or a Panhandle resident other than a driver's license?
Yeah, I was going to say just pretty much a driver's license or something that can show that you are a Florida resident. Usually it's a bill or something, but there are ways to connect with the worker to be able to help you with that. That usually hasn't been a problem, so I hope it doesn't. It won't be soon, anytime soon, but income verification. So if you have some kind of way to do that, and just the need, doctors can refer. So we may be able to connect with the providers to provide whatever information we need if you needed any kind of special services, because clinical breast exams are also included in one of the free services that can be allowed through this program. So like I say, the worker goes through the whole process with you. So it should be an easy way to, it should be easy steps to get that information.
What if you're on Medicare or Medicaid?
If you're already on Medicare or Medicaid, you may already have those services, so it may take care of itself. But I do want to say that if you don't have insurance or Medicare or Medicaid specifically, and you find that you have cancer, whether it's breast cancer or cervical cancer, we do have access, the staff has access to help sign you up for a special Medicaid that will provide help you with care if you do find that you are diagnosed with cancer.
Okay. So the starting point is the Jackson County Health Department if you need help getting a mammogram or you're finding a problem with your breast. And I'm going to put you on the spot, Katrice. You don't have the phone number off the top of your head, do you?
Yes, I do.
I knew it.
No, I don't have to pull out my cell phone for this one. The number at Jackson County Health Department is 850-526-2412. You just ask for the it's prompts, or you can ask for the breast and cervical cancer program, prevention program, and they'll get you to whoever the worker is. We have great workers for that program, and they'll get it started or get whatever you need or direct you to where you need to go or what you need to do to get started. So.
And I know we talked earlier, you said sometimes you get questions about something that's kind of out of your realm, but you probably can find an answer for somebody, at least to kind of get them to go to the right place if it's not you.
Oh, yes. So we're really doing good in Jackson County with resources. You know, a lot of things that happened in the recent years have kind of prompted us to do a better job with resources. So we've always done great. So it's just helped to provide more resources and where we can refer to. If a person, when you ask the question, what other information did I not share? I thought of one thing when you asked that is that if you don't qualify for the program, we don't leave you stranded. We also have resources and a way to refer you to other places or other services or programs that can help you, assist you, even if you don't qualify. So we're kind of excited about that, being able to have that connection, even if you're not eligible for the program.
All right. Well, it sounds like there is help out there and there are resources. 850-526-2412 is the phone number for the Jackson County Health Department. And Katrice Davis, maybe your starting point, I'm sure there are other folks there, but she is the Human Services Program Director for the Jackson County Health Department and again serves all 9 counties in our viewing area. Right?
That's correct.
Okay. Anything else?
No, I think that's good. Just if you find that you have a lump or have any concerns, stay calm. Help is here, like she said. And just contact us or go to your local provider or your local health department, and this program may be available for you.
And we'll get you started.
Yeah.
We should appreciate you driving all the way down here today. This is such important information that we've been trying to research for the ladies out there. Every once in a while, yes, I haven't forgotten about the men, but in most cases, it's women, of course, for breast cancer.
Right.
Thank you, Katrice.
Thank
Great
you.
to have you down here today. Katrice Davis from the Jackson County Health Department. Before we let you go, we do want to show you some other information that we have found through Ascension Sacred Heart Bay. Heather Kretzer is the communications director over there, and she helped me research some of this so we can tell you some ways you can get free or low-cost mammograms, or at least help paying for this because it is expensive, but it's very important. You do have to fill applications out for all of these different places. Visit Sacred Heart Bay Women's Diagnostic Center, located inside the medical office building. They are located 801 East 6th Street, Suite 404, and that is inside Panama City. Now, if you're in Gulf or Franklin County, residents there can visit Sacred Heart Gulf Women's Diagnostic Center, located inside the medical office building, 3871 US 98, Suite 100B. That's in Port St. Joe. They also have something called cricketfund.org, so you can get more information if you want to go online and just read that for yourself to get started. In Franklin County, residents, there is a program that's called Franklin Needs. You can go to info@franklinneeds.com, or you can call them or email them. But their phone number is 678-772-7304. And again, you can email them as well if you want, or you can check out that website first. And then over in Walton and Okaloosa counties, we have a program that is there for residents who are not covered by insurance or cannot afford to get a mammogram. They have a fund that could help. You have to call to see if you qualify for all of these programs, of course. 850-278-3084 or 850-278-3082. And of course, a lot of these programs do depend on donations. That's why they're there. That's where the funding comes from. Many of them are foundations. And so if you're looking for a place to donate your money, maybe you are blessed financially, that would be a good place. You can use any of those phone numbers or websites to call and say, I'd like to make a donation to make sure we keep the women of the Panhandle healthy when it comes to breast health. So we appreciate any of you who might be able to take care of that as well. And again, we thank you for watching. Ladies, check for lumps. Don't delay. And call Katrice if you need help up at the Jackson County Health Department. We appreciate you so much for coming in. And thank you for watching. We'll see you next time.